Hey there, this is Tia Mitchell. I'm a family nurse practitioner student here at Arkansas State, and this is my project, Colorectal Cancer Screening Rates at a Local Clinic. Hope you enjoy. At this time, I'd like to say thank you to my project advisor, Dr. Christopher Jordan, as well as my clinical instructor, Miss Lauren Hancock. Here's a snapshot of my poster in its entirety. You'll have to excuse some of the wording got jumbled from whenever it was uploaded onto this program and I couldn't figure out how to fix it. For that purpose, I have broken down each section of the poster and we'll discuss it shortly. I chose this topic because colorectal cancer is so prevalent. It's the third most diagnosed cancer in the world and the fourth leading cause of cancer-related deaths globally. And that number is only expected to increase. Our population's getting older. Advanced age was the most significant risk factor, 68 years being the median age at diagnosis. The national average of colorectal cancer screening was 67.7%, and that paid no attention to what type of testing was used. Missouri was 65.5%, so right behind there. Missouri's where I'm from. Shockingly, only 58% of the people in the United States have had a colonoscopy. The recommendation I used was from the United States Preventative Task Force, which recommended screening begin at age 50 years and continued until age 75 years. How often screening should take place depended on the type of test performed and the amount of risk that the person had of getting colorectal cancer. The purpose of the study is to compare the colonoscopy screening rates of patients 50 to 75 years old in a local family practice clinic in Bernie, Missouri, to the national average of 58% of patients who are also 50 to 75 years old who are up to date on colonoscopy screening. Inclusion criteria for the study were patients who were 50 to 75 years of age, had the ICD-10 code for screening for malignant neoplasm of the colon. They had a colonoscopy report in their chart within the last 10 years. We had a goal of 50 patients charts that met inclusion criteria with visits between August 1st and November 18th in 2019. However, only 20 patient charts met the inclusion criteria and data was analyzed using Excel. I'm a visual learner, so here's just a breakdown of the different screening methods that were used. Obviously, 10 out of the 20 charts had nothing recorded, but other screening methods were colonoscopy, Cologuard, fecal occult blood test, and fecal immunochemical testing. So this is just a visual of the different screening averages at the national, state, and local level. As you can see, 50% of the charts reviewed had some type of screening method documented, but only 25% of the total charts reviewed had a colonoscopy documented. As you can see, that is way below Missouri's average of 65.5%, as well as the national average of 58%. So I found that 50% of the 20 total charts reviewed were up to date on various colon cancer screening methods, but only 25% of charts were up to date on colonoscopies within the last 10 years. And here's just another visual. As you can see, the 50% with the various testing methods compared to 25% who are up to date with colonoscopies. Limitations included the small sample size and that only one clinic was observed in Southeast Missouri. The research suggests that the clinic does not fully utilize the recommended screening tools for colorectal cancer. Proper use of these screening tools can increase awareness in patients who may be at risk for developing this type of cancer. Prevention is key, so it is very important that the clinic begins to utilize these screening tools so that those patients at risk for cancer have a plan of care in place. And also, since 50% of the patients did not follow through with screening, additional studies may be completed to further evaluate possible reasons they are not complying with the guidelines. And here are my references. Additional references are available upon request. Thank you. Bye.